Greetings to you wherever you are in the world. My name is Wendy Osborne, Senior Consultant with IAVE. And on behalf of IAVE, I'm delighted to welcome you to our 2021 Thought Leadership webinars. A short series of 4 webinars between February and May on the theme of volunteering and social change, with a particular focus on volunteerism and social activism. Please note that the webinars will be recorded and available on the IAVE website. As you'll see from my bio, for over 35 years, I have been involved in a leadership role associated with the development and support of volunteering within the United Kingdom, and laterally at a global level working with IAVE. It is always a privilege to engage with the worldwide volunteering family. And over the past year, the range of IAVE webinars have allowed us to reach a wide diversity and number of people, maintaining existing connections and making new ones. Before we move on to today's topic, I would quickly draw your attention to a few features on the Zoom control panel. If you're having trouble hearing the presentation using your computer audio, try switching your audio settings to phone audio to call in. Please also note the raise your hand icon. During the session, the presenters may ask participants to raise their hands and provide non-verbal feedback. Perhaps the most important feature I would draw to your attention is the Q&A icon. Please do send in your written questions. We really value your participation. Today's session is entitled Volunteers as Key Actors Within Civil Society Dealing with the Impact of COVID-19. This will include highlighting 2 key issues. 1, how in various parts of the world, civil society and volunteers took the lead in responding to the pandemic. And 2, how volunteers are involved in addressing some of what might be considered the invisible impact of the pandemic. As we have sought to overcome the immediate and serious health threats, there have been other indirect consequences that also have a serious and negative impact on people's livelihoods and well-being. For example, increased vulnerability of individuals, growing concern over people's mental well-being, or the threat of financial instability, an increased number of people and families living in poverty. Today, we will showcase and discuss how volunteers are engaging with all of these issues. We will explore what lessons there have been for volunteer engagement during the pandemic and what does the post-COVID-19 scenario mean for volunteering. Please, as I said, do take time to post questions. We want to hear from you and engage with you as we discuss these important matters. I would now like to introduce you to our 2 speakers and panel members. Ahmad El-Zubi is a founding CEO of Naua, a not-for-profit social impact platform that aims to promote a culture of giving and philanthropy and volunteering by connecting civil society actors within a common framework for measuring impact. Emma Thomas-Hancock is from Volunteering Matters. She is the Director of Delivery as part of the charity's executive team. Emma is operational lead for the 80+ projects and programs that Volunteering Matters runs across the UK. These 2 panel members are very well experienced in providing leadership for volunteering within their countries. And I am now going to ask Ahmad to start by giving his presentation in relation to Jordan.
Thank you, Wendy. So hello, everyone. My name is Ahmad El-Zubi. As Wendy mentioned, I represent Naua, which is a social impact platform. And I'm here today to try and maybe share just a little bit of our story on how the national response came about for the beginning of the COVID crisis. And I'm sure that the story is quite similar to what many of you have experienced around the world. We were fortunate enough to have a very comprehensive vantage point of what was happening between the official response as well as the civil society response. And I'm hoping today to maybe share a positive experience of how volunteers and volunteering organizations were able to make a difference for those most affected by COVID. So next slide, please, Jessica. I think it's important to start with a few key dates, just to set up a timeline and to show how dramatic this period was. March 2nd was the first case we had here in Jordan, recorded case. March 15th, within 2 weeks, we had a national close down of borders. And then March 19th, we went up to 69 cases. So next slide, please. And as you can see, this is quite a dramatic increase within 2 weeks. By March 20th, we had a total lockdown in the country. So all movement was stopped except for medical or emergency staff. And it was a, quite a surreal experience, I'm sure, for many of us, for me particularly, to experience this type of restriction in a situation where it was, it wasn't a conflict situation, there wasn't war. It was actually a national pandemic that was going on. Next slide, please. So the first immediate needs that popped up, as we all know, what are we going to do about food, medicine, patients? So there were a few ideas floating around then. Initially, the government wanted to arrange for actual food delivery to homes for, the 10 million plus Jordanians. But that didn't work out as planned. And after 4 days, they eased access. They allowed people to actually go to supermarkets and to pharmacies on foot just to get their basic needs. So that's the world we were living in. And as you can tell, things weren't really planned out. I don't think anybody planned properly for this. Next slide, please. So very quickly, what the government started doing is they set up a national fund with support from the private sector towards health, towards food, but they also restricted the movements of civil society. They established their own task force with, very specific members. And, basically their attitude was, don't worry, we got this covered. As you can see by one of my most favorite memes of Leonardo DiCaprio from Django Unchained down there. Next slide, please. Now, what we thought as civil society was that, okay, great, but are we including everyone? Are we everywhere? Are we able to deal with the needs across, urban locations, across villages, across, the northern parts, southern parts? What about schooling? What about psychosocial needs? What about refugees and refugee camps, which Jordan hosts a big population? And we really wanted to help. Next slide, please. So what ended up happening, what we saw was that civil society itself, whether it was individual volunteers, whether it was proper organizations, NGOs, they started doing their own thing right in line with the public sector response. Obviously, despite the specific ministry directive to not do anything. So we started seeing them delivering critical services. And I highlight two examples of, as you can see, the Jordan 4x4 Club. They were the first to coordinate with the Crisis Control Center to deliver patients, to deliver medication, which is something that the public service wasn't just able to provide. And I included a few more examples if anyone is further interested in that. It was truly a shining moment of cooperation. Next slide, please. Now, what we did is we really thought about a very specific group that was disproportionately affected by the closures, which is informal workers who could not at any point generate their daily income, which way they relied on for their sustenance. They're not covered by Social Security. They're not part of the the tax system. They don't get unemployment, and they were immediately a new section of society that dropped down to poverty that was not accounted for before that time. Next slide, please. So what Naua did is on March 21st, we launched a national call for crowdfunding to support informal workers. We just wanted to make sure that they had enough food. The next thing we did was we also converted all of the volunteering activities that were happening offline to online. So these two things happened in parallel, but I'm going to be drilling deeper into the national response for the informal workers. Next slide, please. So we called it the Daily Labor Campaign. And initially, we just wanted to get enough food for 1 week for those families. But we quickly realized that the lockdown is going to be much longer than a week. So by our first day, as you can see, we raised almost $30,000. First couple of weeks was 300,000. Within 3 months, we had $2.5 million in our accounts. And our biggest problem was, how do we get that out there? Next slide, please. So as usual, we're a light, nimble organization. We relied on our partners. So we developed an ad hoc delivery network that leveraged public sector, local administrations, as well as security agencies, as well as the local NGOs in every different part of the country and the local volunteers there, as well as volunteers to support our work on the field. So we were doing fundraising, we were doing oversight, as well as operations and logistics. And all this was managed by Naua, which I just would like to highlight. Our team is basically 5 individuals. Next slide, please. And just leveraging all of that work and all of those volunteers, we were able to deliver aid to over 85,000 families. We also leveraged our volunteers to support the monitoring evaluation component, who were very critical. They made over 10,000 phone calls just to make sure that things were going properly, because this was new territory for all of us, and certain areas are out of network reach. And they also supported in a very critical role of fraud detection. Next slide, please. So what did we learn through this very, very steep learning experience? Was that, number one, when we all had a common goal, when the danger was clearly visible in front of everyone, we all organized quickly. And almost like every organization fell into its most advanced, most unique role. The second thing was that the existence of these networks that are built on trust, built on history, was really advanced through the availability of data. So systems, numbers, IDs, all of that became immediately critical to identify who are you going to be delivering aid to. And obviously the value of engaging all stakeholders, whether public sector, who were initially resistant, but then became our biggest supporter, or whether it was, that tiny civil society organization down south, that barely has no, online presence. They all mattered in that critical situation. And then obviously the problem-solving mindset with which, I believe the severe conditions sort of forced that upon everyone. A lot of the typical bureaucratic red tape was not as visible during that crisis, just because everyone felt the need. And finally, because we're an online platform, because we're all about technology, I cannot stress the importance of this transparent, visible, auditable system that really drove confidence to donors to give more and support more, and to volunteers who were confident that everything they were doing was part of a bigger network to support the individuals most affected by the crisis. Next slide, please. And with that, I'd like to thank you all for your time. Thank you.
Thank you, Ahmad. I'm going to now ask Emma to give her presentation. Emma.
Thank you, and thanks, Ahmad. That was amazing to hear. Hi, everyone. Yeah, my name is Emma. I'm the Director for Delivery at Volunteering Matters. I'm going to start by just telling you a little bit of background about Volunteering Matters, and then sharing with you our COVID journey as a charity. So Volunteering Matters, what we do, we're a volunteering charity. I'd say we work across the United Kingdom. We're not actually have any work in Northern Ireland anymore. So we work in Scotland, England and Wales. And what we do essentially is it's all about volunteering. Volunteering is in our DNA. We've been running as an organisation for over 60 years, and we're all about bringing people together to overcome society's most complex issues. And we're about building stronger communities through the power of volunteering. Now, the way that we do that looks and feels different in all of the communities that we work in. So in some parts of the UK, our work is very, very much focused around older people and overcoming social isolation and loneliness, whereas in other parts of the UK, our work is focused very much around younger people and skills development. So we're a really diverse organisation from that sense. And what underpins it all is this kind of overriding belief that the people and communities have the power to make the biggest change for themselves. So if you could move on to the next slide, please, Jessica. So why we do it? Well, we do it because we think stronger communities means that everybody has the opportunity to thrive. And actually, as a charity, we've been doing a lot more focusing on what our impact is. And I'm going to share some of that with you as we move through the presentation. But the kind of overriding principle is that when people come together, everybody is better off. In terms of how we do it, well, we work in local communities and we're all about turning local knowledge and energy into action and progress. And that's why our work is so diverse. And that's why it looks different in different places, because we've spent that time to kind of get to know the local communities that we're in, and work with communities to work out what action and what progress is needed. The kind of, I guess, magic ingredient into what we do is, although we're really locally focused in communities across England, Wales and Scotland, we are a national charity. So there are things that we're able to do that are at scale, that we can kind of we can learn from successes and from things that have worked really well in one place, and scale that up and do it in other places. And there are loads of examples across Volunteering Matters where we've done that. So a locally focused charity with a national reach. Next slide, please, Jessica. Thank you. We launched our new manifesto earlier on this year, and there's a much stronger focus this time around creating what we describe as place-based change. So and this is our way as a charity of really reinforcing our commitment to continuing to listen to people, to understand their needs and to work with them to deliver change across the UK. And we've moved on from a focus of it being just about kind of projects and programs across Volunteering Matters to also thinking about our workspaces and using them as community assets. So we've got offices which have been very much administrative bases for the charity historically, that we're now transforming into kind of what we describe as community assets, which basically means we're collaborating, we're sharing those spaces with other members of the community, other voluntary sector organisations, statutory sector partners, the community members themselves, and using the space for the benefit of all. And so that's been a really kind of key change for us at Volunteering Matters. Next slide, please, Jessica. So when we reached that point that Ahmad described last March, where it became pretty clear that lockdown was coming and that it was going to be quite a substantial change for the whole of the UK, we started to focus on what our response to that would be. And as the person in the charity who is kind of responsible for all of our operational stuff, I don't mind sharing with you really that I was pretty scared about the whole thing, really. I was really kind of pretty worried about, I mean, apart from all of the kind of natural kind of concerns that everyone had around the virus and my family members and my friends and people more widely, I was worried for Volunteering Matters and for our projects and programs, because I didn't know how some of the stuff that we were delivering in person, there's such a focus on that kind of the richness of that one-to-one interaction. And I was thinking, how can we make this work if we're all in lockdown? And the approach we took is that we thought we needed to enable volunteers through this process to both protect themselves and the community, to collaborate and to innovate. And that was our kind of, those were our overriding principles in terms of everything that we did from that space on. And it was something that we shared with our volunteers. It was an approach we shared with our colleagues and our partners. So everything that we did from that moment on was about protection, it was about collaboration, and it was about innovation. And for us at Volunteering Matters, what that looked like in reality is we invested in new technology. You know, we've all moved over to Office 365, so we're on Teams. There are loads of new ways in which we can share documents and share Teams channels in and out of the organisation, and that's been quite transformational for us. We redeployed our staff, so we had a number of kind of locally project-based staff that had been working on things in the same way for many, many years. And suddenly we were in a position where they were redeployed to help their colleagues in other parts of the country, both from a virtual platform, in other areas of work with different groups of beneficiaries. And that's been incredibly rewarding, not only for me, for the person who leads that team, but for the individuals themselves. They've met new colleagues, they've met new people, they've tried out new things and developed new skills that perhaps if we hadn't been in this situation, they wouldn't have really had an opportunity to do. We also took all of our volunteer training online, and this was something that I'd been wanting to do for a really, really long time. But it had been something that had been quite challenging to kind of pull together across the charity. So we managed to get all of our training online, and we did some moderation of that to make sure that it was the best quality training that we could possibly deliver. And then we renewed our commitment, our 100% commitment to a community-based response. So we made a really conscious decision that however our volunteers would be deployed, however we would engage the charity in collaborative measures locally, it would all be based around what the community in those areas really needed. So we weren't interested in setting up a shopping scheme, for example, where there was already a really brilliant shopping scheme in place. And we were really looking to kind of fill gaps rather than replicate anything that might have already been happening. Next slide, please. So in September last year, we did our first 6-month kind of impact report on our response to COVID, and it's available. I can send it to anybody who'd like to see it, and it's on our website. And for me, it was just a really fabulous celebration, really, of what the charity collectively had managed to achieve with our partners. And the next couple of slides are some kind of infographics that kind of that summarize our progress up until that point. We've actually, we're weeks away from publishing our next impact report that kind of details what we've done from kind of October through to where we are today. So this gives you a little bit of a flavour of the immediate response, our immediate response to COVID. And so that you'll see there that, during that 6-month period, we worked with a total of 3,000 volunteers, and we've estimated that our figures show that we've helped 15,000 beneficiaries, and that help from our volunteers came in many shapes and forms. So I'm going to talk in a minute and show you a picture of our family packs. So I will just I'll pause on the family pack description for a minute. But in Milton Keynes, which is an area in central England, before COVID, we were running a mentoring program for young people who had been in the care system, and a driving program for older people trying to get to GP appointments. Those volunteers all retrained, and they became volunteers that were focused around doing shopping and prescription runs for older people who were who were at home shielding. In Brighton and Hove, and Brighton is in the south of England, it's where I live actually, our volunteers also did a bit of that kind of delivering prescriptions and shopping, but they did an amazing thing where they took all of our activities and programs online, and run some really fantastic online activities for isolated older people. In Wales, a huge amount of stuff done around youth social action and supporting young people to stay safe online. A lot of focus on mental health and well-being in that area of the country. So much fantastic things. Our mentoring, next slide please, Jessica. Our mentoring support continued for our families and for our young care leavers. And we also entered into a number of collaborations with the British government, and the biggest one by far was the Journey Makers programme, where we were commissioned by our Department for Transport, the arm of government that looks after the transport system here in the UK, and they funded us to run a programme called Journey Makers, which was around deploying volunteers in train stations and bus stations up and down the country, to help people travel safely, particularly as we were coming out of kind of lockdown #1 last summer, where people were really, really nervous about kind of getting back onto the public transport system. Jessica, next slide, please. The other thing that we did that we're really, really proud of, and we're still working on this project now and producing children's packs, is that we worked with our education partners in the east of England to develop these volunteering children's packs, and our young volunteers came together to put these packs together, and they're a kind of fun. There's a focus on fun. There's also a focus on education in each of those packs, and they were sent out to all of the families that had been identified through the support services in the local authority for needing extra support. And that might be extra support because resources in those families were limited and there wasn't very much money, or it may be that they needed extra support because there were some language barriers with parents and support structures within those families. So those packs were produced by our volunteers, and they were distributed by our volunteers right across the town of Ipswich, and when we realised what an important resource they were, we replicated that, and we've been delivering those packs also to young people and their families in London and in Scotland. We also got some funding for a digital inclusion programme, and you'll see there in that photo of the packs that there's also a tablet there that we were able to buy some of those families, so that young people and children could get online, and that has really supported their learning as well. Next slide, please, Jessica. I mentioned to you before our Getting Together Matters programme, and this really came from the work that we started in Brighton, and you'll see there on the screen a little bit of a flavour of the programme that we put together, and it's been absolutely transformational particularly for our older communities that have been at home and not able to get out. There's a real suite of things that they can do every single day, from seated Pilates to singing groups to quizzes, and that's happening every day throughout the day, for anyone who wants to join in. And all of those activities are run by volunteers, and that's a programme that we've now scaled up, and we're running right across the UK, so that we've got older people right across the UK that are engaged in that work. Again, a digital inclusion aspect to that as well. So we've got some funding to be able to help resource and develop a kind of lending library for people that aren't able to don't have the equipment at home to get online. Next slide, please. Thank you. The other thing, and I won't say too much about this because I'm sure that this is kind of routine in many of your organisations as well, but we really looked at our risk management processes and procedures, and we really kind of redesigned our risk management documents and our health check documents for our volunteers, and this made things feel much safer for them in terms of their volunteering. And it also meant that we were much more agile as an organisation. So as restrictions started to lift and as things started to change for communities, our volunteers were able to get back out there and do some face-to-face volunteering really quickly, but really appropriately and really safely as well. And our risk management processes were really at the heart of allowing that to happen. So to finish off, next slide please, Jessica. To finish off, in our manifesto that we have recently launched, we identified the areas that our volunteers make the biggest difference into these 4 areas. So reducing social isolation and loneliness, improving mental health, building skills and confidence and opportunity, and making sure that young people can lead change. So when we started to think about what post-COVID volunteering matters might look like, and what communities in the UK may need from a post-COVID world in terms of volunteer engagement, we're looking at it through this lens and thinking about these 4 areas of the community in terms of engaging them in volunteering, but also providing support via volunteers into these 4 areas. Sorry. Final slide, Jessica. Thank you. So our thinking so far is that when we think about the future, the very first consideration will be what the community needs, and we're not going to make any assumptions. We're not going to assume that what we knew about what the community needed pre-COVID is the same as what they might need post-COVID, and so our kind of communities needs analysis is kind of underway in the communities that we work in. And then we're going to look at how can our existing projects and programs help meet those needs. And we do run some fantastic things at Volunteering Matters, things that I'm really, really proud of. And so our first step will be to think about how can some of the things that we already do kind of help meet these needs. Our collaboration is the key for us, and that's been a huge lesson that we've learned through the pandemic, that the only way to get these things done, the only way to really meet the needs of communities is to work in collaboration with other organisations, and that's other statutory partners, voluntary partners and corporate partners. Everybody has to be working together side by side on this. There's no space for egos or territorialism in the work of volunteers, particularly the focus around recovering from the pandemic. We've also done some reflection. So what have we learned? What have we learned that's worked really well? What didn't work quite well as we'd hoped? And what new skills and interests do we have within our teams that can help us build this future? What knowledge have we acquired? And then, of course, the usual things that organisations think about. How can we resource that? What funding do we need? What backup do we need? And then finally, health and well-being is the key. Unless health and well-being of our staff and our volunteers and our beneficiaries is at the front and centre of our minds when we think about what comes next for the organisation and for the communities that we serve, unless we are thinking first and foremost, how does this affect the health and well-being of the people that we work with and our stakeholders, then we might as well not do it. So health and well-being has become a much bigger focus for us in terms of rooting that around our thinking for the future. So that's the end of my presentation. Thank you so much for listening.
Thank you. Thank you, Emma. And indeed, thank you, Ahmad. Both very comprehensive presentations. And we have questions coming in, but I'm going to start with one of my own, which actually one of the participants has also asked about. And it's just, I mean, you've both identified volunteers as key actors in responding to COVID-19, albeit from very different cultural and political situations. And the initial reaction in many countries, if not all countries, was that the key responder for addressing the pandemic should be government. And I'd like to ask each of you your experience of the interface and relationship between volunteering leadership organizations such as yourselves and government. So the practical question is, how did it work? What was the impact? And what did you learn? And I'll start with Ahmad, and then if you can also address that question, that'd be great, Emma.
Yeah, absolutely. And quite a significant question to that. And see, when we think about how it worked, maybe our position as a national organization that is part of the Crown Prince Foundation here in Jordan, maybe that, you know, that does give us a specific advantage in our relationship with the public sector. So we were already working on establishing these networks. We already had this back and forth discussion on how to increase the participation of volunteers. The specific advantage we had was that we actually built a national platform where anyone that wants to volunteer or anyone that wants volunteers can go and register and benefit from that service. But when COVID hit, it really became a challenge to negotiate the resistance of perceived interference in public sector matters. So what we tried to demonstrate was that we are capable of providing that support in an organized fashion within the limitations or the conditions that the public sector needed. So that was quite critical. For example, they really wanted to know who was benefiting from all of these aid deliveries, right? Down to, you know, like the national ID number, to the address, to the phone numbers. And typically volunteers don't usually capture that information. But for us to make it work, what we proposed was that, okay, let's do this in partnership with, you know, the security services. Let them be part of the distribution efforts. So we actually had, you know, volunteers riding with you know, civil servants and security agencies, whether police or army or whatever, and they would go about distribute the packages. We were able to facilitate that relationship because of the network that we had already built. Now, what was the lesson learned moving forward is that the actual existence of ready to deploy volunteers would have been you know, very beneficial. And what I mean about this is the more specialized volunteers. So, you know, like all the doctors, the pharmacists, the nurses, the engineers, like we did not have that data. So that's something that we are today working on with the government. We're working on expanding the volunteering profile. And I'm happy to announce that 3 weeks ago, the government actually established the first ministerial volunteering committee. So first time ever in Jordan, there is a minister heading the volunteering portfolio. And for us, that is phenomenal.
Thank you, Ahmad. Emma?
Yeah, I mean, that's amazing. Congratulations, Ahmed. That feels like a big achievement for your organisation. I'm sure you've been involved in lobbying for that. In terms of how it's worked in the UK, we've been involved at Volunteering Matters in something that's called the National Coordination Cell. We call it NCC because we always like to give everything a very short abbreviation. But the NCC is chaired by my boss, actually, the CEO of Volunteering Matters. But it's actually a collaborative group of CEOs from across the voluntary sector, particularly the infrastructure voluntary sector in the UK. And the mechanism for the NCC is that all of the requests that each of the government departments, when I was doing my presentation, I talked a bit about journey makers and the bit of work that we'd done that was funded by our department for transport, where all of the various different government departments across the UK national government particularly had been looking at how they could involve volunteers initially in their response to COVID, and then latterly in the recovery to the to COVID and the community's recovery to the pandemic. And what the government departments did was that they channeled all of those requests for volunteers in various different initiatives that they'd thought about through one of the government departments, the government department that we call the DCMS, which is the Department for Culture and Sport. So it's the kind of government department that looks after all the arts and the museums, and a lot of the voluntary sector funding is channeled through that part of government in the UK. And so what that bit of the government, the DCMS, did was they collected all of those responses, all of those requests from different government departments into one central place. And then they fed those requests into the National Coordination Cell, which is this group of voluntary sector chief execs. And they all meet once a week, and those requests still come through now. And what the group of chief execs do is they kind of triage them, I guess. So, and some of them, it's a kind of absolute no-brainer. It's like, yes, this is a brilliant thing for volunteers to be involved in. And then more often than not, one or two of the organisations will collaborate to kind of build a proposal up about what volunteer engagement might look like. Sometimes the requests come through and there's quite a bit of pushback. There's quite a bit of like going back to government and saying, no, actually, you know, and even though we're in a point of global crisis, it's still not an appropriate thing to ask volunteers to do. So there's been a lot of those kind of discussions, and then there's been some of the discussions that have been a little bit in the middle of those things, saying, well, it's not quite appropriate, but if you did that, this would be a good thing to do, and all that kind of stuff. So what we've established through the NCC is a real kind of collaborative approach to coordinating the voluntary sector and government's response to what the community might need. And from that, there's been some really robust funded programs that have enabled volunteers to do lots of really great things in their communities. In terms of, I guess, what we learned from it, we've learned that collaboration is the key. It's absolutely the key, and it works both ways round. It works between the voluntary sector, but it also, more importantly, that collaboration with government, local authorities and other statutory bodies. If we can collaborate together to kind of work out where the needs are and where the funding is best placed. And I've not seen that happen really in such a formulaic and organised way before this pandemic. And I guess the challenge now, both to that group of CEOs and also to the government officials that have been involved in that, is how can we keep that dialogue going long term, and how can that dialogue be extended out to issues that kind of extend beyond COVID, I guess. So still some learning to do, I think.
Thank you both. Thank you both. I mean, I think this is a really interesting point. It's clear that both of you, in relation to volunteering in government, that the pandemic has been an opportunity to build relationships, and that you're hoping that in the future that will grow and develop and promote, support and develop volunteering even more than it is now. So congratulations to Jordan. Some people might be envious of what you have achieved there, Ahmad, but no doubt these are really good examples for the rest of the world to take note of. And I'm going to, on the back of that, we had a question from one of our participants about the vaccine rollout. Again, I think most governments will see that as a their primary responsibility. So I'm wondering from each of you, do you see roles for your organizations or for volunteering in supporting the vaccine rollout? And Emma, if you can say something quickly, and then Ahmad.
I mean, absolutely. And we have had some of the volunteers that have been involved with volunteering matters have been involved in the vaccine rollout, but through the NCC, the National Coordination Cell that I was describing, a vaccine rollout program has been developed by one of our charity partners, the St John's Ambulance, and they have recruited volunteers to support the vaccine rollout across the whole of the UK, and it's been a fantastic triumph on their behalf. I've been lucky enough to have a vaccine, and my experience was that I was met at the door by a volunteer. I was shown where to go by a volunteer. I was after I'd had the vaccine, I was my welfare was checked over by a volunteer, and I was booked in for my follow-up vaccine by a volunteer. So I think there's been a great amount of work happen, all coordinated by our partners at St John's Ambulance, who have really kind of put that programme in place. And it's also been rolled out by other voluntary sector partners across the UK as well. So it's been a real credit to the power of collaboration. And it's been a real credit to organisations and to individuals who've had to really challenge themselves about what appropriate roles for volunteers to do. And actually what we've seen is that there are loads of really brilliant things that volunteers can do through the rollout of the vaccine programme that has actually helped make it quicker, and has helped, as we almost always see, has helped make it a better experience also for the people that are having the vaccine.
Okay, great, thank you. Ahmad, are there any plans in Jordan?
So absolutely. Conceptually, I have little to add to what Emma has said about the role of volunteers. Absolutely essential. Right now, we're conducting we help the Ministry of Youth as well as Ministry of Health organize a number of youth, roughly, I believe, 500 participants, to support the national efforts to raise awareness on the need for the vaccine, because we do have a challenge encouraging people to register for the vaccines. Maybe they don't have the information, they don't know where the centers are. So there's a huge effort happening there, as well as, at the same time, raising awareness about, wear your mask, social distance, all of that, because that's still an issue. And we've recently had a huge spike in cases here in Jordan. And I think now more than ever, it's really up to us as volunteers to help spread that message and remind people that, COVID is going to be staying here for a little while longer. It's not over yet. And that we all need to continue to remind each other. So that's just one of the things that we're doing to support.
Okay, thank you. Now I'm looking at the questions that are coming in, and I'm not sure we're going to get through them all, but we'll do our best. The next question, there was interest in funding and how your work has been funded. And particularly, has there been corporate funding for your work? Emma, if you could say something, and I'm sorry, I'm going to have to ask you to keep your responses as short as you can, quick, because we do have a number of questions. Thank you.
There has been some corporate funding, yes, absolutely. And we've had some in-kind corporate support as well, a lot of brilliant support from our corporate partners, both. But you saw those packs, the photos of the packs. There's a lot of donations and a lot of contributions that way. We've had some central government funding, and then we've had a huge amount of funding from our local trusts and foundations who have opened up their fund to support the COVID effort, and funding from our national lotteries as well.
Thank you. Ahmad?
Absolutely. We rely on our private sector partners, on corporate funding, but also on individual funding. So which is also, in our belief, a huge source and a more sustainable source of support once people believe. So it is definitely part of the formula. It comes part and parcel with volunteering. And maybe happy to share offline more about what we do when it comes to funding and crowdfunding.
Okay, well, that's an offer we might take you up on, Ahmad. So now there's been a number of questions about online and this move to virtual volunteering. The questions are around what are the challenges to that? And certainly, do you think that is the way of the future, this move to virtual volunteering, and what are the challenges to it? And also for you, Emma, associated with that was the question about your training now all online, and a practical question about what kind of platform you actually use. And I suppose I would add to that how your volunteers have taken to training online. So if I could ask you both to answer both of those, and Ahmed, I'll start with you.
Absolutely. So yes, the shift to online was a it wasn't really an option. It just had to happen. People wanted to do something and they couldn't move. So what we noticed was a spike of new opportunities, and we actually have data on this, how all opportunities converted to online for like the first couple of months and then went back down. Right now, it's about 50%, 50-50. 50% is online, 50% is offline. The types of offline activities have now shifted towards more, like basic needs, essential needs. Everything that was like awareness, training, networking type stuff, all those volunteering opportunities are now happening online. So I think that this shift is here to stay. It does not mean that the offline type of volunteering is gone. It just means that there's more opportunities to contribute and help other people that are enabled by technology. And it's important for all of our organizations to be equipped to deliver that type of volunteering.
Okay, thank you. Emma?
Yeah, absolutely. I think I agree with all of the things that Ahmad has said. I mean, I think from our point of view, I think we're probably moving towards a blended approach where some of it's going to be online and some of it won't be. In terms of some of the issues that we have encountered, we've had to kind of relook at our safeguarding stuff, particularly for young people, and put some protocols around that. We've had a lot of chaperoned types of activities. In terms of some of our older activities for our older people, there was a lot of concern around health and safety by things like doing online exercise classes. And then what do we do if it's someone who's zoomed into something and then they collapse and we don't know where they are, we can't send them help? And so there's been a whole lot of stuff that I didn't really think about beforehand that we've had to kind of put behind the scenes protocol in. In terms of platforms, we've used Teams and Zoom. As a staff team, we all prefer Teams because that's what we use all the time. But we recognise that our volunteers are more used to and find Zoom a lot easier to use. They have enjoyed, I think, the flexibility of the training. We run a lot of training for our volunteers, and it was always very focused around staff availability. So some of the training would always be at the weekend, some would be in the evening, some would always be during the day. And what we've been able to do by taking it online is to offer a whole range of those opportunities. And what we found then is that we have onboarded people, trained them, got them involved much quicker than we used to. So some of that stuff we must continue to do in the future. And I think using online platforms is definitely part of our future. But the richness in terms of what our volunteers are able to do in communities comes when they get the opportunity to do stuff face to face, and we'll absolutely be getting back to a big chunk of that as soon as it's safe for everyone to do so.
Okay, thank you. I think to that, we've had a question. I think this is a question. This is a global audience, clearly. I'm not sure about Jordan. I kind of know about internet coverage in the UK. In fact, I keep getting this note today telling me that my connection is unstable. So I'm hoping that it will be able to take us through to the end. But there is a question about, I suppose it's about equity. And the question was particularly about young people. How can you engage young people? Indeed, I would say, how can you engage anyone online whenever actually they don't have access to proper internet connections? So has that been an issue for you, Emma, or an issue for you, Ahmed?
Yeah, it's been an issue for us, and we've applied. We talked before very briefly about funding. Much of what we've applied for has been kind of what we would describe as digital inclusion budgets. So we've been really aware that actually to make sure that we can reach people who are really, really isolated, that part of what we might need to resource that will be some equipment for them. So we've had money to develop a lending library. We've also had money to buy tablets for young people that have got mobile data in that we can keep up to date. But we can't do that for everyone in the community, and I think it is a limitation of doing everything online. And that's where the collaboration comes in. Actually, that's where collaborating with other voluntary sector organisations that may have a kind of digital inclusion budget or may have some kind of digital inclusion support within their provision. For our older people's work, it's been about collaborating with housing providers so that they can get that support maybe through that route as well. But absolutely, it's an issue. It's a very live issue, and it's something that we're always trying to find creative ways around, but unfortunately no magic answers.
Okay, Ahmad, is it an issue in Jordan as well?
Absolutely, and it was even compounded further by the need for remote education, distance learning. So everyone tried to do their part. We did similar to what Emma's organization did. Tablet distribution, a laptop distribution, SIM cards, preloaded SIM cards with internet access, all of that. But maybe one good example of what the government was able to do to sort of go around this lack of connection, they actually established mobile wallets for many of the beneficiaries to help facilitate direct cash transfers that did not necessarily require internet connection, but usually GSM connection. So there's a lot to be said over there about inclusion and coverage. We haven't found the silver bullet yet either, and I think it needs a lot of collaboration and a lot of investment as well.
Okay, yeah, I think that's true, and it's a global issue. I now want to turn to, I've had a number of questions about, and I think this always crops up when we're talking particularly about this particular issue, about safety, the issue of keeping our volunteers safe. And I know that's quite a substantive issue, really. You touched on it a bit in your presentation, Emma, but if you could both just touch briefly on that. Have you had to put in particular measures? How have you kept your volunteers safe during this particular, keeping them involved during the pandemic? So Emma, do you want to say?
Yeah, I mean, all of the things that you would probably expect us to do. So risk management documents, risk assessments, the use of PPE and the provision of PPE, some protocols in place around social distancing. So we have had some mentoring, face-to-face mentoring that's continued outside, but we've been pretty prescriptive about where outside and distance between individuals and that kind of stuff. We've had protocols in place about travel to volunteering opportunities. So if someone's available to volunteer, but they have to get several modes of public transport, then we probably wouldn't engage them in that volunteering opportunity. Whereas if they could perhaps drive or walk to something, then we would encourage them to do it. So all kinds of different routes in. We've also had a process of kind of a health checking our volunteers. So there's a kind of checklist that the volunteers fill in just about how they're feeling, really, in terms of potential COVID symptoms or health and well-being issues, and we update and review that really regularly. So if there are any red flags, then we can kind of support people through that. More recently, our volunteers that are on the front line, so our shoppers and our drivers and some of the other things that I described, those volunteers have been offered the opportunity to have vaccines because of their kind of frontline volunteering role, which has been brilliant. But we're not mandating that. We would never do that. We would never say, you can't volunteer unless you've had a vaccine or anything like that. That organisationally, that doesn't feel quite right. But that's a bit of a kind of a quick tour of some of the things that we've done. But I mean, basically everything we do, we have a good look at it before we go any further.
Thank you. Ahmad, has that been an issue for your organisation in Jordan, the whole thing about safety of volunteers?
So definitely, and very happy to hear what Emma's organisation has done. Super advanced. I guess on our part, it was pretty early on in the crisis where we really had to have people mobilize across the kingdom. So, other than providing protective equipment and guidelines and all of that, we also made sure that any types of delivery are not done, face to face. We also made sure that all the packages were obviously, sterilized and cleaned up and all that. And finally, we had at all times, public sector representatives, security agency representatives, to make sure that everyone was doing things according to the public sector guidelines. But yeah, quite an important topic. Absolutely.
Okay, thank you. We're coming up to the end now. I mean, I have not been able to ask all the questions that were posed. I'm going to take the liberty as moderator to get in with the final question, and just to ask from both of you. I mean, there has been some discussion about, you know, the pandemic being both a positive and a negative for volunteering. In a sense, a negative because some people haven't been able to do their volunteering, the very simplest thing, and a positive because obviously it has attracted more people to step outside their doors and step forward to help out. So I'd like each of you to give very briefly your opinion of what do you think the impact of the past year has been on volunteering, and what are your hopes for the future? So since you've got the screen, Ahmad, I'll start with you.
Okay, so the impact that we've all seen is that this national sense of unity, that we're all in this together. Okay, that has been huge. It's a great unifying factor that, you know, we haven't seen in any other recent event in history. At the same time, there's this growing sense, especially amongst youth, that we can actually do something that matters. And, you know, getting that sense, getting that feeling up, you know, with youth is so important as part of national efforts to build in the sense of, you know, active citizenship, you know, engaged citizenship. So that's just phenomenal. Okay. And the challenge becomes then for us moving forward is how can I help them direct those efforts in meaningful ways that can contribute to the community, and at the same time, you know, help build their skills. All right. Maybe help advance their careers, maybe, you know, get them to join some organized, volunteering organization. So in a sense, you know, we're all very, very hopeful. We're all doing our best to make the most out of it. And I'm thankful at least for having that opportunity to help, you know, put youth at the forefront of this national movement to help each other through volunteering.
Excellent, thank you. Emma.
Yeah, I mean, I've worked for Volunteering Matters for over 20 years now. So I've volunteering, and the power of volunteering, I think, is in my DNA. And I've always, you know, been passionately enthusiastic about the role that volunteers play. And one of the things that I think has been positive from the pandemic is I think the rest of the world have seen that now, and I think there's no going back. And I'm really excited about what the future looks like for the future of volunteering, because I think it's been really shown that volunteers are the people that can make the difference when the chips are down. So yeah. So all power to volunteers and to people involved in volunteerism.
Well, thank you. Well, on that note of hopefulness and excitement, I think that's the perfect way for me to say thanks very much to the panel. It has been a pleasure to share this conversation with you. And we could have kept on going, but unfortunately our time is up. So thank you, both of you, very much.
Thank you.
Thank you, Wendy. Thank you, IAVE, for having us.
Yeah, thank you very much. Thanks.
So now I just have to remind participants that we do have our next webinar on this series on the 12th of April. So please do join us, and please do think about becoming a member of IAVE. We are all can be great individual advocates for volunteering, and I think that's we're building a global movement, which we're very excited about. So thanks to everyone, and look forward to seeing you at the next webinar.